The motion be agreed to, and I call the member for Goldstein.
Medical background.
Thank you, Deputy Speaker. Unlike the outstanding member for Higgins, I don't have a medical background, so my position is from the heart as much as it is about the substance. But the reality is, we know, Deputy Speaker, Australia is facing a challenge around an ageing population, and one of the great challenges coming with an ageing population is the fullness in which people can live their lives, the medicine that can support them in terms of the assistance and the care they need, and increasingly the challenge that people face in managing multiple conditions at the same time. Now, most people will probably look at some of that story and say that is a point of concern. But frankly, Deputy Speaker, it's a sign of just how much progress our society has made. It wasn't long ago that so many people died from conditions that were otherwise curable. But through rollout of science and technology, research and innovation, we've seen many conditions which were once death sentences now being mere blips in people's moments of their lives. And of course, what we know is that we're only getting stronger. The potential for us to be able to cure many conditions, or people be able to chronically manage conditions so that they can live a full and happy life regardless of who you are, regardless of your circumstances, continues to grow. But we can only support that type of medication and that type of assistance and support to those who need it because we are a country that is strong, that is prosperous, and we can fund research, innovation and access to medications and medicine that in many other countries on earth people simply will never have the access to because of the cost. And that's driven by an innovative model, but it's also driven by our economic base. And that's why simple measures that are economic are human. Getting the budget back in the black, making sure that we have a surplus and making sure we live within our means isn't about dollars and cents, Deputy Speaker. It's about making sure that we can fund the medicines that people need. And what we know is that we're also on the cusp of great new innovations of precision medicine with research, with development and commercialisation, where we can practice medicine and deliver healthcare with the potential to revolutionise medication the way that penicillin did many years prior. And that's the exciting moment that we sit on right now. The Australian Council of Learned Academies report The Future of Precision Medicine in Australia highlights how precision medicine will create new care paradigms and shift our health system from one of crisis management to the reality of a genuine health management. In time, precision medicine will support new possibilities of disease prevention, saving costs and maximising the benefits to our health system. But, Deputy Speaker, why waste time talking about our health system when the real beneficiaries and the real strength and the real success of precision medicine is not what it does to a system, it's what it does to Australians and the potential for them to be able to live out the fullness of their lives. And it's not just that it has enormous potential for those people who need help, but it's also the potential in terms of growth in industries and sectors where Australia can lead the world. In August 2019, we had the Minister announce a total of $3.7 million for fellowships that will build bioinformatics capacity and capability, including just over $1.5 million to Dr Adam Ewing from the University of Queensland to explore the relationship between changes in DNA and changes in health. And that investment sits across the huge investment that this government has made across the board in precision medicine and through bodies like the Medicine Research Council and the National Health Medical Research Council. Research into precision medicine does provide a human benefit, but of course it creates an economic opportunity of highly skilled jobs and support for those people in our healthcare sector. So those people who are going to university today and studying healthcare and medicine and pharmaceuticals can see the pathway where they can do their research and their science base of their qualifications and the job opportunities that are at the end of it. And it creates an opportunity for us as a country to be a world leader so that we can export our services and health and medical services and our research base to the world. Thank you, Deputy